Good morning and good afternoon, everyone. Welcome back to the DASH webinar series. My name is Carissa Novak, and I'm a program manager at the Harvard Global Health Institute. I'm excited to welcome you here today for what is our second webinar in the new DASH webinar series, Sustainable Business Models for AI in Health. This webinar is part of a new 4-part virtual event series co-hosted by the Novartis Foundation on the intersection of AI, COVID-19, and low resource settings. It builds off a previous 8-part series we hosted in the spring and summer as part of the Data Science and AI Summits for Healthcare. On Wednesday, December 2nd, we will have our third webinar entitled AI, Health in the Future Workforce. For more information on this webinar and others, including recordings of past webinars, please visit us at dashinafrica.org. In today's webinar, we bring together panelists with a diverse range of expertise in data science and AI to reflect on the types of partnerships and structures that need to be in place to ensure high-impact products and digital tools reach those most in need, both now and well beyond the pandemic. Before we get started, I have just a few housekeeping notes. This video is being streamed through Zoom, Facebook Live, and the recording will be made available on the DASH website afterwards. We'll be running a live Q&A towards the end of the webinar, so we've enabled our Ask a Question feature on the bottom of your screen. If you have any questions during the webinar, just pop it there and we'll do our best to answer them during the Q&A portion. We've also enabled the chat function, which will be monitored and overseen by my colleague Luke. When using this function, please make sure you set the message recipient as all panelists and attendees and not just the panelists. To get us started, we would like to invite all our participants to use the chat functionality to let us know where you're connecting from today, including the city and country. I am calling in from San Diego, California. With that, let me introduce you to our speakers today. Marliese Gergens is a senior specialist at the World Bank, leading a global program on decision and delivery science in health and human development. The aim of this program is to accelerate the use of analytics and digital health innovation to improve human development outcomes in low and middle income countries. With an academic background in engineering, mathematical modeling, public health, and predictive analytics, her career started in management consulting and then switched gears to international development, working first for the government of Malawi and later for the World Bank. Marliese has spent over 20 years working alongside governments, the private sector, and not-for-profit organizations in low and middle-income countries, improving the efficiency and effectiveness of health and education programs. Cole Ciroc is an investor and entrepreneur with over 20 years of experience founding, investing into, and otherwise supporting entrepreneurial ventures. He's currently the co-founder and CEO of DocDoc, the world's first patient intelligence company. On the investment side, Cole is currently a managing director at Founders Equity Partners, a direct secondary investment fund. Prior to DocDoc, Cole spent 7 years in the direct investment team of Temasek Holdings. He also has served as an independent member of the board of directors for Global Eagle Acquisition Corp. Cole attended Massachusetts Institute of Technology and Harvard's Kennedy School of Government. Bakar Bhatt is an advocacy specialist focused on the promotion of sustainable digital development, ICT infrastructure expansion, and investment through collaboration and multi-stakeholder partnerships in the Middle East and Africa regions. Bakar is the CEO and a board member of Samina Telecommunications Council, which serves as a sector development partner to governments and the telecommunications industry. In his capacity as CEO, Bakar helps bring together and builds alliances between digital ecosystem stakeholders, including regulators and other government bodies, to address critical technocentric policy and regulatory issues. His efforts have directly helped drive key regional initiatives, summits, and roundtables in areas including affordable infrastructure, advanced digital services, data and privacy regulation, spectrum management, and industry fees and taxation. Bakar is a strong advocate of advancing socioeconomic progress and contributing to the achievement of the UN Sustainable Development Goals. And lastly, our moderator, Sarah DeRosie, is a stakeholder engagement lead at the Novartis Foundation. She's a global health professional dedicated to using the power of innovation and partnerships to solve today's health access challenges. In 2020, Sarah joined the Novartis Foundation to shape the outcome measurement work of its cardiovascular urban health initiatives and to build cardiovascular population health approaches in low and middle income countries that are driven by innovative health and care delivery. Prior to this, Sarah held roles at the WHO, UNAIDS, and the Clinton Health Access Initiative, and built her expertise in program and grant management, focusing on strengthening health systems and increasing access to affordable services and medicines globally. Through all of these roles, she worked closely with health authorities and partners in countries like Haiti, Tanzania, and Cameroon. And with that, I will hand the mic over to Sarah, who will be leading the discussion today.
Thank you so much, Carissa. I'm very pleased to welcome you all to this panel. We're joined today by a broad range of guests in the audience. We have entrepreneurs, policymakers, officials from international organizations, healthcare providers also. So to everyone, a very warm welcome. I'm honored to have the presence on this panel of esteemed guests, Bokhar Ba, Cole Sinacek, and Marie-Lise Gorgens. And really, thank you so much for being with us today. This will be an interactive session, so please don't hesitate to ask your questions in the chat, and we'll do our best to answer them at the end of this conversation. My name is Sarah Desrosiers. I'm representing the Novartis Foundation, and I'll be moderating the discussion today. The Novartis Foundation, at the Novartis Foundation, we want to reimagine the way health and care is being delivered in low middle-income countries using the power of digital and AI. And this is why the topic of today is so important for us to engage on and to explore together with you. So what's our intention today? Well, we'd like to identify the major bottlenecks and also enablers to achieve sustainability of artificial intelligence innovations in healthcare. And our guests will help us explore the topic and define some of the key questions that we need to resolve as a community to move forward. You may know that the Novartis Foundation co-chairs the AI in Health Working Group of the Broadband Commission for Sustainable Development, and that earlier in September, we had the great pleasure to launch our report together with our partner, which is called the AI to Maturity Roadmap. It's a very interesting report that I would encourage all of you to take a look at, because not only does it offer a number of different current examples of AI solutions for health around the world on topics like diagnostics, virtual care, drug discovery, and health coaching, but it also describes 6 major areas that policymakers can work on to fully integrate digital and AI in their healthcare systems. So without further ado, let's begin, and let me turn to Bokhar, if you don't mind. Bokhar, you've worked 30 years of your career in technology and telecommunication, building alliances between innovators and government players. You're also a commissioner and contributor to the Broadband Commission report on AI in health, which I just mentioned earlier. Can you tell us more about your background and also help us define the meaning of sustainability of business models in AI in health? Thank you.
Thank you, Sarah, and good evening to everyone from Dubai. I'm first of all, very pleased to be here today, and I would like to thank the organizer for this opportunity to share some thoughts with you and have this conversation. Let me start, if you allow me, Sarah, to start with a bit of context before answering your question. In today's discussion and subject, we have 3 important components: health as an industry, AI, artificial intelligence as a technology and a mean, and the notion of sustainable business model that has lately become very well established across industries. This is primarily so because we are no longer operating or doing business and experiencing life as we did when digital communication access was not so prevalent. This is one of the main reasons why over the past few months, calls for surviving in the new normal have been sounding. Just look at the consumption of data over the past months. the way all of us with multiple devices are connected to the internet. Data access and influx have been on an exponential rise. Now, catering to this surge in data-driven communication requires high investment in ensuring network technology operators as intended and network to remain robust and resilient to the current situation. Considering now that some of the best case for the meaningful use of internet connectivity have been established by the healthcare industry, especially when the ICT industry collaborates with it, it becomes obvious that we have now new set of bright possibilities that we can create for the society, especially the societal segment, where either connectivity has yet to reach or where healthcare is not available, or even both. Now, in this regard, it is essential that we create, as a group, an environment which should be collaboration-driven, innovation-conducive, and propelled by partnership with artificial intelligence technology providers. And it all starts with government taking the lead in creating the right enabling environment. And it also necessitates aligning inter and intra-industry priorities with those of the government vision and build a crisis preparedness mindset to deal with the current and future challenges. Now, let me come to your question. I just wanted to explain the context that we are in. The subject is sustainability of business model in the digital and AI health space. Now, connectivity is a prerequisite, connecting everyone, everything, everywhere. And I'm referring to the global discussion about broadband connectivity or 5G networks. This is the foundation that we must first talk about before we delve into what it means to be sustainable in business model. That's the first element. I assume that we have connectivity across the board. Now, there are four foundational pillars for sustainability in the context of business model to be utmost important. The first one would be, I would call that sectorial collaboration. It's very important to have collaboration between the ICT, information communication technology industry, and the healthcare industry. In the ICT industry, we used to talk to ourselves. Now it is time to talk to the others and to talk to the healthcare industry, explain them the challenges that we are facing and how we could address their requirement. Now, example, we need to have, in the context of healthcare industry, meaningful services. We need to have meaningful application. We need to enable machine-to-machine communication. We need to enable machine-to-human communication. And I will elaborate on that later on. Another example, we need to identify services to be monetized by the telecom companies. We need also an enablement by the government of the right policies and the right regulation that will promote infrastructure deployment, cross-border data flow, and I will explain in the context of scale, and data protection regulation, because we are in a data-driven economy. Partnership is important, and it should be led by the private sector. And defining the type of partnership form can be undertaken by partnership in cross-industry. For example, all telecom operators should connect all hospitals. Hospitals needs to be connected. Another example, partnership with small and medium enterprise and entrepreneurs. Partnership that will foster ICT and health talent and build human capital, human investment. That's the first foundation. The second foundation is about investment or funding or financing. And that should be injected by the private sector once the first requirement are met, understood by all the stakeholders, and alignment in terms of priorities. The third pillar and foundational element would be to create a scale. The mass adoption is the next pillar. The objective of scale and creating economies of scale is central. Digital health poses tremendous opportunities in this regard. I can give you one number. Estimation by the industry is about $31 billion between 2020 and 2025. So it's a huge opportunity. And here, I'm sure my colleague Cole will address technical issues such as standardization, harmonization of processes regarding the flow of data. And the last one, and I don't want to be too long, is about innovation. This last pillar is where great things are happening. Engage entrepreneurs, especially the young innovator. With the hardware and software and web technologies we have in hand and the digital prowess of our youth, this engagement is absolutely necessary to encourage and foster ICT and artificial intelligence talent in the application of AI technology, of course, with immersive technologies, virtual reality, augmented reality in the healthcare. And last point, we need government to champion those initiatives by creating incubation center for creating talents. So all these elements that I have listed, I believe would be the foundational pillar required for addressing the sustainability issue in this context. Thank you, Sarah.
Thank you so much, Bokar. I think you've really set the stage very well for us and for the audience. I'd like to move to Cole and pick up on some of the main elements that you've mentioned, Bokar, in particular around government support and incentives and scale. So Cole, you're the co-founder and CEO of DocDoc, one of the largest doctors networks in Asia. And your AI-powered solution is really helping millions of patients access better healthcare, fit to their actual needs. Can you tell us more about your journey within DocDoc and also help us understand how you've achieved sustainable scale of your business? Also, can you explain a little bit more about some of the points Bokar has raised and help the audience understand whether you've had those kind of supportive elements to help you launch your business in Asia? Over to you. Cole, I think you're muted, so if you can unmute yourself, please.
There we go.
Great, thanks.
So I will address all of the things that you asked, maybe not necessarily in that order, but I think that the purpose of this is talk about digital health and what's happening in health globally. And I think that even in the best markets in the world, you see at best weak market forces. And you see a perfect example of this is medical inflation. So I was just looking at the latest report at Singapore, Malaysia, Hong Kong, and Indonesia, and all of them had medical inflation that was 10 times greater than the rest of the consumer price index. And in many of those markets, it was well north of 20 times. Now, that's not because of technical progress that we're having that level of medical inflation. It's because the market forces are such that every year in many of these markets, the doctors can just charge more. They just every year want to up their prices. And the market forces don't allow the consumers to choose. So they do, and the hospitals do. And why do they do that? Because in capitalist systems, you do what you can get away with. I mean, and so this is where regulators play a terribly important role. And this is where AI comes in a very big way. Because, you know, and when I decided, and I'll get into the journey here, but I never really wanted to be a healthcare entrepreneur. I didn't start out when I graduated from grad school. I went out and got into private equity, and I really had no desire to go be a digital health entrepreneur. But I had a really tough situation happen with my daughter. And, you know, she was 100 days old, and I took her in to get a checkup. Thought she was totally healthy at the time. And the next thing you know, they say your daughter's liver is failing. And we need to do this massive medical operation right now. We're going to take her in. And she's this big at this time, right? I'm a first-time parent. And I was blown away at how much information I didn't have access to. How many times have they done this procedure? How can I measure if you're any good at this? What is this going to cost? What are the long-term consequences? There was no data available to me. And so I started digging in. Why is there no data available? I mean, this was a $1 million plus procedure. And I mean, I had the money and I had great insurance, but that didn't matter. I'd never purchased anything in the world that had such little access to information. And it turns out in healthcare, the reason you have rampant medical inflation and the reason the market forces are so weak is because you've got giant special interests in the hospital industry, in the insurance industry, in the pharma industry, in the medical device industry. And what you don't have is patient special interests. And so what's happened is the patient pays insurers. The patient works for an employer. The patient pays a government indirectly through taxes. So the health system is designed to take care of the special interests as a primary piece. And I bring this up in the context of AI because all of the data that's trapped in the various silos inside of healthcare, this is why there's not stronger market forces, is because the hospital doesn't have an interest in seeing the data move. The individual clinic doesn't have an interest. The insurer hasn't figured out how to use the data, even if they got it. So the data becomes very locked in silos. And if you really want AI, so long story short, I'll switch back to my daughter now. So there I am with my daughter, and I call a good friend who's a surgeon, and he comes over, literally puts his arm around me, walks me out of the room, and he says, "Cole, don't let anybody in that room touch your daughter. They're qualified, but they haven't seen very many cases like this. And we need to find one of the top teams in the world. This is very unique, and it's a big deal." So we found it turned out my daughter needed a liver transplant, and we found the inventor of the live liver transplant and the highest volume team in the world in Japan. It turned out that we needed to do this procedure, but we needed to do it in terms of weeks and not hours. We flew to Japan. We did the first procedure there. We flew the team back to Singapore, and we did the full transplant here, and I was the donor. And after this, I committed myself, and my wife committed ourselves to solving this problem. This is what entrepreneurs do. They overcome. They do things that are above and beyond what a sane, easy person would do because there's a burning reason for it. And most of the time, it's really personal. So I took on this fight for patient transparency. And this is how we're going to break the back of medical inflation. It's how we're going to make drug discovery vastly more accessible. It's how we're going to improve access to care. It all comes from data transparency. So AI is just a function of data. It's nothing more. AI is nothing more than some parlor tricks that you could basically do in Excel if you were really good at it. And I can get into structured data. I can get into machine learning. We can get into all of that if you wanted, but that's not really the key. The key thing that drives this is access to data. So what governments need to do is they need to decide that, particularly in healthcare, access to data is a right. And when can you get that access? Who can get access to the data? When can they get it? How can they get it? And what's the format? Once you've standardized these pieces and you demand it, the world changes in digital health. Everything becomes exponentially easier to accomplish. You can begin to create services that empower patients with data to make informed decisions. Pharmaceutical companies can begin to get an understanding of what their retail price versus their wholesale price is in the markets. You'd be blown away. Novartis doesn't know what the retail price of their drugs are in the markets that they sell to, because they sell in Asia, because they sell to doctors' offices, and then the doctors' offices just decide to charge whatever they want. And there's no feedback loop on that. They have to literally do secret Santa shopping to get some sense of what the retail price is of the drug. So this is where, if you really want to see a very interesting example, at MIT, we studied this concept called system dynamics, and how inadvertent consequences that governments do have massive long-term consequences later on. Like the tip of the whip, the movement of that sine wave versus at the top of the handle of the whip, and over a function of time. And in South Africa in the 70s, they decided that all medical billing had to be done in a standardized way. So every bill that came from a hospital, came from a clinic, had to go to a health switch, then to an insurer. And it had to come in a standardized way so it could be moved electronically. Because of that, the insurers had access to data. Do you know who leads the world in sophisticated health products to help their consumers? South Africa. Why? Because they had access to data. So the regulators can establish the formats and they can demand that the data is available. When they do that, AI and digital health moves into warp speed. And the entrepreneurs don't have to be as dog-eared and determined as Grace and I have to make DocDoc a success, because the data is available. That's where you really begin to see it flourishing. And I'll stop there.
Thanks so much, Cole, for sharing such a personal story. I think it's really inspiring to hear how DocDoc was created. And to touch upon this topic of data silos and challenge of accessing data, I'd like to turn to Marie-Lise. Marie-Lise, you're leading data science and health innovation at the World Bank. And the World Bank has been actively funding health innovation as well as the COVID response in the last year. So I was curious to hear more about your role in the data science space, and also some of your thoughts around this issue of access to data, as well as to understand what the World Bank has been doing in the last year in particular in relation to COVID.
Very much, Sarah. Touching on the points that Cole just raised with regards to the market failures that we see in digital health and AI, I agree very much with Cole that the challenges of digital health and AI revolve principally around data. I think in low and middle income country markets, which look very different because they're primarily not private sector driven markets, but governments delivering healthcare to its populations, right? So if you have a healthcare system where the government employs doctors, nurses, pharmacists, where you don't have the majority of healthcare financed through insurance companies, but the government either has a national insurance scheme or the government just directly employs and provide healthcare free of charge to its population. Obviously, the market failures would look a lot different in those contexts. That said, the challenges and opportunities that we've seen across all these different spaces have been similar, and they have to do with fragmentation, data silos and fragmentation of data, but also I think primarily the fragmentation of solutions. In fact, I think it is effective to talk about a digital health epidemic, and the digital health epidemic that we've seen is just this letting 1,000 flowers bloom challenge. In a country like Ethiopia, for example, they recently, last year, did an assessment and found that there were over 200 digital health apps in government health facilities, of which the government knew of less than a third of them. And if we have this situation where the government is not even aware of data that are being collected, applications that are being used, with no regulations, with very little data stewardship, we're not going to solve problems in an incremental way. Which brings me to the issue that I think is most important, and Cole touched on this. I think the extent to which digital health and AI solutions will be sustainable will be the extent to which it solves problems on the ground. And part of the problem is the way in which healthcare is delivered at the moment. Countries have to reimagine primary healthcare. They have to create a digital front door to service delivery, which is one of the things that DocDoc is doing by creating this direct access. but it involves reimagining primary care. It involves reimagining frontline service delivery. And unless we can fit digital technology within that context, we're not going to be successful. I very much agree with what Cole said, that AI, digital health, these are all just tools. They're all means to an end. And the end is better, more equitable, preemptive, predictive access to human contact in healthcare. But that's what we have to strive for, is creating a new, reimagined primary healthcare system, frontline healthcare system that will use technology. In fact, in the bank's work on digital health, we promote this concept of delivering healthcare in a digital world as opposed to digital health and AI, so that the focus is not on the technology, but the focus is on what the system looks like, how we can use different leverage within the system to change how healthcare gets delivered, to focus on consumers as opposed to patients, sick patients who walk through the door, how we can focus better on prevention, how we can link and integrate between facility-based and community-based healthcare. We have literally armies of community healthcare workers, for example, in low and middle income countries, that we are helping them to digitize their service delivery through lots of different mobile apps, but very few, if any of those, actually use AI. So we're still on the end of helping to digitize and digitalize workflows and data, as opposed to thinking about how to use that data to solve problems. And I think this is where governments have a dual role to play in envisioning the system, and then in both creating incentives and regulation for private-public partnership to solve these problems in an integrated way, and not to let 1,000 flowers bloom, because this fragmentation in digital health and the lack of concerted data stewardship will only continue if we continue with the 1,000 flowers bloom approaches to digital health. Although these problems have preceded COVID, the COVID financing and COVID response says that countries are standing up, is providing opportunity for these problems to be addressed. They also pose the risk of these problems to be exacerbated just because of the speed with which COVID responses are being implemented. But there are definite opportunities to build back more inclusively, to not just go back to the way things were, but to use this as an opportunity to reimagine and recreate primary healthcare systems of the future. Healthcare systems in which not just data are linked and applications are linked, but in which consumers have a choice where to vote, and how, where consumers have a choice to vote with their feet in terms of accessing good quality healthcare. And that, I think, is at the gist of solving the issue of sustainable business models in AI, is getting that right.
Thank you so much, Marie-Lise. You've really touched on an important point. This focus on consumers, the human-to-human contact that you've mentioned. And I just wanted to pick up on that topic and try to dig a little bit further. Going back to Cole, you are operating in emerging markets, and I was wondering on this topic of consumers, given that you're really focused on trying to help patients get the right information that they need. How have you been able to overcome some of these issues of accessing data, and how did you build a model where you really have the user at the center?
Yeah, no, it was the hardest possible way. I mean, it was, if I wasn't committed to doing this for totally personal reasons, I would never have done this. There were easier ways to make dump trucks of money than to do this. We had to go door to door to 23,000 doctors and collect the data by hand. We had to go clinic by clinic, doctor by doctor. We never found a single hospital in all of our efforts. We had a lot of hospitals that were willing to work with us, a lot of insurance companies that are our partners. None of them had access in any of their markets to a structured data approach based on code sets, international global code sets that was even anything but really gibberish. So we had to go door to door, collect the data ourselves. We had to then partner with one of the largest and most successful digital third-party administrators in South Africa, and then bring their technology to Asia, and then begin to partner with insurance companies and teach them from the ground up how to actually collect data in a way that was useful. And all of that can be short-circuited by government. The government can play a profoundly effective role by coming in and saying, it wouldn't even, I mean, an easy way would be just to buy DocDoc. If a government could just buy it and then say, here's your standard. All the payment gateways come in this way for the whole country going forward, and it's a public good. Or they could get together and they could agree to a global standard. The Center for Medicare and Medicaid did this under Obamacare. They could take that standard and they could use that. They could use what's happened in South Africa as an example. But the nut of it is you have to have the data to come in some kind of a consistent way. I mean, the arbitrage opportunity in healthcare is mind-bending because it's completely opaque. So what we're in essence doing at DocDoc is we're using data to steer to doctors that are better at the procedure the patient needs than the average doctor. They're in the top decile most of the time, and they're in the bottom quartile in terms of price for that procedure. Those kinds of arbitrages happen everywhere, in every market in Asia. In every market in Asia, the United States, and South Africa, anywhere we've ever looked with data, the arbitrage is there. Because the market's totally opaque. And it shouldn't be opaque. It's opaque because regulators are not valuing data with they're not understanding that it is the root of the public good that's being mismanaged to result in the failure of all of these market forces. And you will never have AI reach anywhere near its full potential without massive access to structured data.
Thanks, Cole. That's really insightful. I think that the topic of regulation is extremely important, and I'd like to turn to Bakar to discuss a little bit more about this. Because Bakar, you've worked a lot with governments, and you were even mentioning in a previous conversation we've had some of the challenges of portability of data, not only between governments and countries, but within governments. This challenge of interoperability of data and data security. Could you maybe talk about this a little bit more and tell us what are some of your thoughts around how to address this major challenge that we're seeing, I think, especially acute in low middle income countries?
Thank you, Sarah, for the question. And first of all, on the previous discussion, I do not have an expertise or background in the health industry, so I cannot comment on how the health industry is organized in country. However, we have been talking about data, and there we can have a conversation. And for our discussion, for people to have a good understanding about the data industry that we have in front of us, the data tsunami that is coming up, we are working on the 2030 agenda. Everybody has heard about the Sustainable Development Goals. And health comes into play on SDG number 3, which is good health and well-being. Through technology, we are trying to achieve the objective SDG number 3. Now, just for everybody to make it clear for everyone, over the past 2 years, 2018, 2019, we have created more data in 2 years than the entire history of the humanity. In 2 years, 2018, 2019. And in 2020, we will be creating more data than the past 2 years. It means we will be facing a data tsunami. So What do we do out of the data is the second part of the discussion. But first of all, we need to manage this data. We need to carry this data to be able to be successful in digital health, in real-time application, like an operation between US and Africa, all these applications that we are talking about. So that's one element. The second element, into artificial intelligence, we are going to have connected devices. We are going to have so-called IoT. And to give you an approximation, in the world today, we have 3 billion mobile subscribers. Once we will have enabled the IoT devices, the ratio is 1 to 10. So if we have 3 billion connected people, we will be having 30 billion connected devices to manage. And those devices will be producing data. So technically, number one, it's important that the globe and everybody move into what is called IPv6 to be able to manage all these devices, connection, and people. That's number one. It's the first challenge that regulatory authorities are facing. Number two, the implication of international organizations such as the ITU, because ITU is a standardization body, and they have a platform where the data format is being discussed, the standardization of the data, the aggregation of the data, all these challenges that will lead us to what Cole was talking about in Marily's data analytics. What do we do out of the data? How do we do the interpretation of the data? These are going to be tools for fast decision-making processes. And there is a regulatory angle about data privacy, because that is a huge discussion happening depending on the country governance, in country, in region, and internationally. The discussion is on different platforms. To answer your question, the third challenge that we have is the adherence to compliance norm of stakeholders for cyber resilience strategy, because the more data we have, the more cyber security issues we have. And there we need also to address it, and this is being discussed under cyber security and cyber safety format. You mentioned about ethics. It's important in artificial intelligence. Technology in general, and AI particularly, has to serve the humanity, not the other way around. It's a tool that should benefit us for SDG number 3. So in artificial intelligence, we are using algorithms that need to be analyzed, that need to be audited for a simple reason: to avoid, for example, discrimination, to avoid racial profiling, to avoid segregation of population, segregation of gender, segregation of age, you can name it. And to be compliant with good governance in terms of human rights and inclusion. Remember, we have certain divides that do exist in the world, whether digital or otherwise. All effort should be exerted to ensure that we do not increase divides further. This is where the ethical application of artificial intelligence in health comes into play. And the health is absolutely personal. We have heard the personal story of Cole. So number of challenges are being addressed, not that the governments are not aware of, but we have so many compounded problems and challenges to address. And that is the reason why we have a multi-stakeholder dialogue happening in different platforms, whether it is the Broadband Commission, the ITU, the World Economic Forum, the G20. Most of the platforms existing are discussing about these challenges. And we believe that the best way moving forward is to have leadership from the government to champion those initiatives and to bring the partners and stakeholders together in order to have this fruitful conversation. Thank you, Sarah.
Thank you so much, Bukar. This last point that you mentioned, leadership from government, is especially important because there's a lot of things that seem to need to be coming from the government, incentives, regulations, and other major elements that can support improving access to data, interoperability, standardization, etc. Marilise, may I come over to you? I think that you've done a lot of work in public-private partnerships, and the World Bank is really a major actor in the area of funding of health innovation. I was wondering what has the World Bank done, or what is the involvement of the World Bank around this topic of regulation? And also, do you see a role of public-private partnerships to contribute to improvements and standardizations around data?
Thanks very much, Sarah. So yes, absolutely. I think we will only be successful in applying technologies of digital health and AI in solving health problems if we have private-public partnerships. But I think we need a new generation of private-public partnerships. We need private-public partnerships that recognizes the value of shared data as a global public good. I think we need private-public partnerships in which we, in a symbiotic way, focuses on doing good, improving population health, improving value-based care, and the commercial incentives that is inevitably there with private sector companies. I think we need to think about business models, which we have not yet spoken about, that is less about selling technology or selling devices, but more about selling expertise through subscription-based services. Take South Africa, for example, where I was born. The system that Cole describes operates in the private healthcare, private health insurance environment, which covers about 20% of the population in South Africa. So 80% of the population accesses free healthcare through government-financed, government-run health facilities. There is not a fragmentation of data, but an absolute lack of data about how much procedures cost, about quality metrics for delivering healthcare, quality metrics for individual procedures. The government's accounting system just doesn't allow the government to have these kinds of data available. So it's about creating equity in data between private and public sectors in how data are valued. And of course, regulation is essential in that space. Part of the technical assistance that the World Bank provides, in addition to the financing for healthcare delivery and digital health and AI rollout, is also to help governments to put together digital health strategies to do redesign of their health systems so that they can incorporate these technologies in a much more purposeful way in the past, whilst ensuring that health data standards are maintained, that digital modalities of service delivery are included in the central coding through which health services get billed when there is a private sector involvement in private sector health insurance. And then I think what is incredibly important across all of government, not just in the health sector, is a focus on good data stewardship. And we would argue that this focus on data stewardship and data governance, which has been sorely lacking in the health sector, but I think across all of government and across all of society, we need to think about national structures, but also supranational structures for thinking about how we regulate the world of data and how we regulate this exponentially increasing set of data that are available in the world. It's so interesting to me how in the health sector, we're always complaining that we don't have enough data. Yet the conservative estimates are that of the global data sphere in the world today that is exponentially growing, as Bukar said earlier, around 30% of that data is health data. And this is the last point I want to make, that I think what is important in successful private-public partnerships in this space is to focus on the lowest hanging fruit first, because we have, unfortunately, in AI and health, often started with the highest hanging fruit and tried to sell the highest hanging fruit to governments that have not made it an attractive option. For example, clinical decision support systems. We know it requires real-time ingested data. It requires electronic medical records, digitized medical records, which for individuals are often not available in the public sector run health systems. Not data about one patient. We don't even have a unique identifier that we can track a patient as they move from government clinic A to government clinic B, right? So there's such basic things to do with unique identifiers, open HIE, which somebody spoke about in the chat, right? One of the biggest challenges that the open HIE network has is to just convince governments to put their data in the cloud where it can all be linked, right? There's still governments who are building their own data centers and not putting things together, right? I think we need to start with the lowest hanging fruit, and by starting with the lowest hanging fruit, is to use that to build confidence in digital health and AI, and build not just confidence by governments, but also capacity within governments for these solutions and how they work and what they can do. And I think if we have those kinds of approaches to private-public partnerships, they have a much bigger chance of being not just successful in the short term, but sustainable in the long term in improving health. Thank you.
Thank you so much, Marilise. Very interesting points that you made here around data stewardship, building the capacity of governments to handle all of those issues as well. Unique identifiers of patients, I think that's incredibly important. We're seeing that as a real need across countries as well. The hour has flown by. It's almost time. So what I wanted to do is maybe leave us on one last question to the entire group. And actually, I'd like to spin a little bit the topic that we've been addressing. We've been talking a lot about access to data. How about financing? And the question I may ask to all of you is, what are some of the needs that you see in the financing models around AI solutions today? Are there needs for new types of pricing strategies for some of those products? And how do we best monetize AI solutions, but always with patients and users in mind? So if I can start maybe with Cole, hand over to Cole, thanks. Cole, you're muted.
Good, because I never say anything important in the beginning. I don't know. You know, money follows opportunity. And there are massive opportunities in digital health. In fact, the arbitrage opportunities in this space are mind-bending. And I think that as long as regulators make it possible for entrepreneurs to do the right thing and to be rewarded for it, they'll do it in healthcare. I think that's going to be, that's hard to do though. Like, I just want to emphasize to you, if I didn't have the background that I have and Grace didn't have the background that she had, we couldn't have kept DocDoc funded. It's been funded by really high net worth individuals that have just stepped in over and over and said, we believe in this, just keep going. We believe. I mean, you know, entrepreneurs, I do a lot now trying to help other entrepreneurs understand this journey a little bit. And the best you can do in life is share your perspective from your limited set of experiences. It doesn't mean that you have any monopoly on truth. And so from my limited experience, what I try to share is that when you fully commit to something and you burn your boats and you leave no path for pulling back, you'll find that resources come to you. You'll just figure out a way. Necessity truly is the mother of invention. So don't be afraid to be in desperate need of something. It's where you'll be the most creative. And we've been early in digital health. In fact, the entire industry is just starting. Because, I mean, think about it. We had to go door to door to collect the data. So we're in a panel about AI, and it's cute, and AI could do massive things in the space. But we have people that really understand what they're talking about on this panel mentioning unique identifiers associated with patients. Forget about the conditions that they have and the procedures they have and their medical records and the history of that. See, it's really hard to structure digital health. It's one of the hardest sectors there is to build the underlying data models. And that's the first piece you have to tackle. And regulators need to step in to make it a requirement. There are ways to do this. There are great pieces of work that's been done in the past, but it takes time. And the first couple entrepreneurs that crack this, I think, will be very successful. And that will allow a lot more funding to come into the space. You know, my old boss at Temasek was just mentioning that he's going to put billions of dollars in the space. So there are a lot of investors that are looking at this and saying, I think it's time it cracks. It's one of the largest sectors of the global economy, and digital health has barely made a scratch on the surface of it. So I think there's a lot of room to run, a lot of room to run. And the capital will find its way. It doesn't need anything specific.
Thanks for those remarks, Cole. How about Bokar? Could you give us some sort of closing remarks and also your views on the future of funding for AI solutions?
Well, I agree with what has been said earlier. The starting point is to have favorable policies and regulation that will trigger investment. Now, investment is one term. Let's talk about unlocking access to capital, because there are different types of capital investment. When we talk about investment, we need to have return of investment from the private sector. So it has to make sense. It has to make profitability. Shareholders are driven by return of investment. So, and opportunities are there. So they need to have the favorable environment and framework. When we talk about financing and funding, we talk about other stakeholders. It could be development bank for a country, it could be insurance, it could be other stakeholders that are involved in the capital market that could be interested to bring into money into the country. And in that case, you need to create scale. And these are where we have most of the challenges: access to data, have more transparency, because we are talking about mega project. The third part of unlocking capital is about stimulating the innovation and entrepreneur. Marlies was talking about, in terms of monetizing, having services. To be able to have meaningful services, we need to have the right health application. And this is where we call upon the innovators, the entrepreneur, to make those services meaningful. Telecom operators will be a carrier of data. But if we want to have access to those services, to use the services, it has to be meaningful. Therefore, my message is that yes, it's a huge market that we have ahead of us. It's a huge industry, and collaboration is needed. Partnership is needed, but it's a jargon. When we talk about PPP, I would add a fourth one, public-private people partnership, because when you look at, as an example, during the COVID, those tracing apps that were deployed across the globe, if you don't subscribe, the application is meaningless. So you need to have the engagement of the population as well. So everybody has to be around the table, build partnership, and those partnerships could be time-bounded. It could be depending on an emergency situation, but the partnership has to be framed right. But investment is available, capital is available, funding and financing is available.
Thank you so much. Thank you so much, Bokar. Turning quickly to Marie-Lise, some few words, a few closing remarks from your end.
I think it all comes down to value. At the end of the day, if governments see value and if health consumers see value in the services they will figure out a way to pay for it. And I think that's what we have to do a better job of communicating, is what the value is, how to access the value, and how it makes a difference to people's health. And I think we'll figure out the money models that follows that. But we're still struggling to communicate value. And until we can do that, I don't think we'll be successful or sustainable in this space.
Thank you so much. So as a quick summary for me, I've learned a lot from this conversation. Thank you so much to our guests. The importance of greater collaboration between public and private sector actors, the need for sharing of learnings around data access, around standardization, the need to follow the value, follow human-centered initiatives that really support patients ultimately and increase access to healthcare. Thank you so much for your engagement. It was a wonderful conversation. And thanks to the audience as well for all your questions. I'll be handing over to Carissa. Thanks a lot.
Wonderful. Thank you so much, Sarah. That concludes the second webinar in our new virtual event series. Thank you to our panelists and our moderator for such a wonderful and deeply engaging conversation. We're grateful for your time, as we know how truly valuable it is. To our audience, thank you for joining us. We hope to see you again on Wednesday, December 2nd, for our third webinar focused on AI, health, and the future workforce. Have a wonderful afternoon or evening wherever you are.